morning guys, Todd Sparks down at Performance Plus Physical Therapy in Chula Vista here with Bree today. Today we're going to talk really quickly about spinal stenosis. If you look at a model of the spine, spinal stenosis can occur kind of in two different areas. Either what's called the central canal, which is down the middle of the spinal column, or on the sides of your spine, and that's called foraminal stenosis or neuroforaminal stenosis. And what happens with stenosis is the nerves begin to become impinged or pinched on. So we're going to show you a couple different things. Some signs of stenosis are low back pain, numbness, tingling, pins, needles down into your buttocks, down your legs, and into your feet. Generally, people with stenosis, they prefer to sit or lie down. They like to flex their spine, and they do not like to extend their spine. Common activities that extend your spine include just standing and walking. So if you're 50 to 60 plus and have numbness, tingling, pins, needles, low back pain, and you prefer to sit versus stand and walk, then you may have spinal stenosis, and I'm going to show you on Bree a couple different things that you can try on a daily basis that may help your symptoms. So the number one thing is, again, spinal stenosis patients prefer to flex their spine because flexing the spine opens up those little holes either on the side or in the middle. And actually some recent studies show that by flexing your spine forward, it actually increases that space by about 25%, and it'll take pressure off the nerve for you. So the most common or the best exercise we like to do is just seated flexion. So Bree is just going to sit in a chair on the edge of a table, and what she's going to do is just go ahead and try to flex down in between her legs. And as you can see, when she does that, she's opening or flexing the spine. And this again can create up to a 25% increase in the amount of space where the nerve runs through in your spine. So she's going to hold it for a few seconds, and then she's going to go ahead and come on up. And she can repeat that 10 to 20 times, and she can do that as many times throughout the day as she possibly can. And in the ideal situation, that will decrease the numbness and tingling she's having in her legs. The second thing we're going to do, we're going to have you flip around with your head up here, if you don't mind, Bree. She's just going to lay down on her back. You can do this in your bed, on the floor. And from here, all she's going to do is take her knees, go ahead and grab them, and pull them up towards her chest. And again, feel a nice stretch in her low back. She's going to hold that maybe for 30 seconds, and she's going to try to repeat that 3 times. And again, she can do that several times throughout the day. So that's your 2 little tips for today. If you think you may or you actually have been diagnosed with spinal stenosis, remember you want to flex your spine and avoid extending your spine. Thanks and have a great day.